Now begins the Obesity Symposium. May I invite our Chaipersons to take their positions. Dr. Sunil Prasobh, Professor of Medicine and Diabetology, Government Medical College. And Dr. Arun Shankar, Medical Director, Jothydev Kesavadev Hospital and Research Center, and Secretary, IME NAME.
So good afternoon to all of you. That was a fantastic introduction to the Wegovy session. So let us move straight forward to our much awaited Wegovy session. And first we have a topic, Semaglutide 2.4 milligram, stepping into the realms of high efficacy obesity managing medications. We have this talk by none other than Dr. Jothydev Kesavadev, and in fact, he needs no introduction, the single man behind this conference, and I extend my sincere thanks to him for inviting me also to this conference, and also congratulations for the fantastic the crowd turnout and the fantastic conference he has arranged for us. He doesn't need any introduction. All of you know him. He is a chairman of Jothydev Diabetic Research Center in Kerala. He is an organizing chairperson of the upcoming National RSSDI 2025. Over to you, Jothydev sir.
Thank you, Dr. Sunil Prasobh and Dr. Arun Shankar. And once again, thanks to Novo Nordisk for giving us this golden opportunity in Trivandrum to launch this blockbuster molecule. And that too, along with all our friends sitting in the front row. And these are my disclosures, and you have seen the video, and this has been very, very impactful, similar to semaglutide. And my responsibility in the next 10 to 15 minutes is to go through the STEP clinical trials. We are all here, and this energy, this enthusiasm, and our ability to smile, move around, it is a result of hunger. And hunger is an ancestral, it is an evolutionary instinct. And this is absolutely required for our existence. But in sharp contrast, now in 2025, we are discussing how to treat obesity. And that is a paradox. And I am reminded of a person, and this is a lady, whom I met exactly 10 days ago. And she's only 25 years old, very young, and she came from a different state in the country, from a faraway place. She came alone, and with a BMI of 37.6, and she's on 3 antipsychotic agents. She's employed, unmarried, and this is what she said. This young girl told me, I used to be a normal person until 6-7 years ago, but now I am on medications, and I believe that I am getting treated for something called body dysmorphia. And I don't even talk to my friends. I am not close to my parents. I don't have a boyfriend. I have realized that obesity is a disease. And I have realized the importance of getting treated for my obesity. And that is a revelation for her. And then we spoke for more than 10 minutes, me along with my team. And then I asked her, can I discuss the lab reports? Can I discuss the consequences of obesity with you? And she said, okay, of course I agree. And that is the reason why I have come. That is the reason why I have traveled a long distance. So I am open. Now I am having a mind which is open to all the discussions, and I am brave enough. Because I know that if I am getting treated for obesity, I can even stop the medications that I am having for my psychiatric disorder. And we started discussing about the body composition analysis. So yesterday we listened to Dr. Benshi and Narvari and the paradox, the Benshi-Narvari, I think it has appeared in the media today. And this was the body fat mass, and we discussed about the weight control which is required. And then with her consent, I discussed about the definition of obesity, The next speaker, we have Dr. Shashank and then Dr. Hemant Thakkar, and they will again be discussing about the definition, that is adiposity-based chronic disease, that is ABCD. And this definition is very important. And Obesity Medical Association definition, obesity is a chronic disease. It can be lifelong. And more than 50% of those, including me sitting in this hall, we are obese. And obesity, if not treated, it is a progressive disorder. And even when treated, it can recur. So it is relapsing. And the good news today is it has now become a treatable disease, though it is multifactorial and with multiple neurobehavioral components. And recently, Dr. Anu Mishra and the team came out with a new definition. Many of us are members of this steering committee, and the BMI of 23 or above in India, 23 or above, is now considered obesity. And the stage 2 is when there is one additional comorbidity or one additional parameter, such as increase in the waist circumference also. And again, I discussed with her consent. The lady is sitting in front of me. I discussed with her the complications of obesity, more than 250 complications. More than 250 possible complications, and some of these associations are very, very strong. In deep blue, not only diabetes, not only the obstructive sleep apnea, not just the hypertension. We do have multiple difficult to treat malignancies as well. And these M's are important because I show this slide to my patients before starting on diet or exercise or on therapies for obesity. I show this slide to my patient, and this is on 4M, the mental consequences. And my patient sitting in front of me, she has got almost all these mental consequences: cognition, personality disorder, anxiety, the metabolic consequences, diabetes, gout, obesity-related cancers, another big entity, broad entity, cancers, mechanical, GERD, obstructive sleep apnea, the plantar fasciitis, headaches due to pseudotumor cerebri, the monetary consequences. Of course, I do agree that treating obesity with a drug such as Wegovy is expensive, but consider treating the complications of obesity. More than 100 or 200 complications of obesity, which will be far more, 10 to 20 times more when compared to just treating obesity. And this is a physiology which you are all very much familiar with. Earlier, we used to eat when there is hunger, and that is homeostatic hunger. And that is when there was a calorie requirement. But now, even in the absence of a caloric requirement, even when you are not hungry, you are attracted to the sound, the smell, the taste, the environmental influence, and that is defined as hedonic hunger. And this is the third element, that is executive function. These are the 3-layer appetite system. And if you ask somebody, please remember, there is a strong association of obesity with genetic parameters, almost 50% relationship with genetics. And hence, you may have to treat them because there is no other way. It is not modifiable. And I don't know whether Dr. Suresh Purohit is there among the audience. He always used to make a comment. In your clinical practice, dear doctor, how many patients have you seen successful enough to reduce their body weight and is successful to sustain the reduced body weight? The answer will be almost zero. With diet and exercise alone, it is extremely difficult or almost impossible to sustain the lost body weight. And if you go back to the clinical trials, and these are multiple trials on only diet and exercise, people will reduce their body weight. So you can see there is a significant reduction in the body weight. They may have reduction in the hemoglobin A1C or other parameters, the blood pressure. But over a period of time, when you follow the same patients, they will regain the lost body weight. And they can regain much more. They can regain 2 kilogram or 3 kilogram more when compared to the baseline. And this is the normal physiology. And this is described as the normal physiological adaptation. And going back to the older days, and this is when we used to discuss liraglutide with the same exact mechanism of action. So this is the switchboard, that is the hypothalamus, the hypothalamic regulation of appetite. You have the GLP-1, you have polypeptide, the pancreatic polypeptide, the peptide YY, the oxyntomodulin acting upon the pro-opiomelanocortin card, and this induces satiety and suppresses appetite. Whereas the same pathway, it can inhibit the NPY agouti-related protein, increasing the appetite. That pathway is suppressed by the GLP-based therapies. And one another pathway is there in the hindbrain. So what happens when you are losing the body weight? So when you are losing the body weight, you are successful in reducing the body weight with diet or exercise or with anything, any drug also, there is conservation of energy, there is reduced metabolism, there is increase in ghrelin, the hunger molecule, and these hormones in turn results in regain of the lost body weight. So this is what normally happens. You cannot blame them. So never blame those obese people who come back regaining the lost body weight. Because obesity results in overeating. Overeating doesn't result in obesity. That is the new thought. And going back to the pharmacology, with diet and exercise, in all these clinical trials related to placebo, the placebo has resulted in approximately 2.4 to 2.6% reduction in the body weight. Whereas the drug such as Wegovy or injectable semaglutide has resulted in 15 or 20 or more than 20% weight loss. Remember the olden days, this much weight loss, more than 12 or 15% weight loss was possible only with a gastric banding or a Roux Y. So it is actually replacing the surgical techniques or the procedures or interventions for weight loss. Much more safer, convenient, comfortable and adoptable. And GLP-1 based therapies are not new. GLP-1 based therapies are around for almost 19 years now. And this is a very old one. And this coincides with the first edition of JPEF, that was in 2012. Liraglutide, Victoza, and weight loss and hemoglobin A1C reduction, and even we published data on remission of type 2 diabetes. And now I move on to the discussion on Wegovy 2.4 milligrams with the same, exactly the same mechanism of action as liraglutide as shown earlier. And Wegovy or injectable semaglutide can suppress both homeostatic and hedonic hunger. So both ways. So it's a dual mechanism of action. And these are the long list of those step clinical trials. Huge data, huge wealth of data. And this is a drug which is now being used by diabetologists, by the physicians, by the general practitioners, by the endocrinologists, by the gastroenterologists, by the cardiologists, by the orthopedicians. Look at this step 9. And this is in osteoarthritis. So there are huge data available. And this is essence in MASH outcomes. So that is why this is a blockbuster drug. And it is because of the huge demand globally, it took many years for this drug to reach our country. And this is the Indian contribution to the global data, more than 3,500 participants from our own country in multiple clinical trials related to semaglutide. A summary of step 1, and that is the first step in obesity clinical trial, comparing injectable semaglutide against placebo. Remember, in the introduction, I said about how to administer this drug, starting with 0.25 and then every month escalating to the next higher dose. And this is how the clinical trials are also being conducted. And look at the weight loss, phenomenal. When compared to placebo, 16.9% reduction in the body weight, and with 1 in every 3 people losing equal to or more than 20% weight loss. So this results in a phenomenal, incredible weight loss with even remission of diabetes. More than 92% of patients achieving equal to or more than 5% weight loss. And look at the secondary endpoints. And these are all incredible data. More than 15% reduction in the waist circumference, reduction in the systolic BP, diastolic BP, hemoglobin A1C, and even the inflammatory marker. In obesity, if you perform C-reactive protein, invariably in almost all the patients it is high. And the reasons are also well documented, and there is a 58% reduction in the C-reactive protein with injectable semaglutide. No wonder it is now used in multiple specialties across the globe. And in step 4 clinical trial, what happens when the drug is withdrawn? A very, very frequent question by our doctor colleagues, by the patients. What happens when you withdraw the drug? And this is how it is randomized until 20 weeks, and beyond 20 weeks, in one arm, the drug is continued, and the other arm, the drug is replaced by placebo. So when you withdraw, the mechanism is the same, the physiological adaptation, and the weight regains. Of course, it is only 6.9%, but when you continue semaglutide, it still results in a consistent, persistent reduction in the body weight, that is 18.2% body weight, and long-term data is available. So this drug is no longer new. So we have data for 2 years and we have data for more than 4 years. It is consistent. It is a durable therapy. The weight loss is maintained. I still remember with liraglutide, though there was a weight loss, the weight loss was actually not maintained beyond 6 months to 1 year. But here, there is a maintenance of the lost body weight. And do you have any questions on the side effects? It's the same. It's the same GI side effects which is attributable to any GLP-1 based therapy. And these are the GI side effects, vomiting, diarrhea, very rare. And these adverse events are mild to moderate, and they are more during the drug escalation time. When you are escalating from, for example, 0.5 to 1 milligram, you should be careful. And if possible, support them via virtual consultations. And all of us, we do have a lot of patients on injectable semaglutide for many years, because people used to procure it from outside India. And this is one such female, a case from our own hospital, and she was earlier on Victoza liraglutide 1.8 milligram. And I think 1.5 years ago, we switched over to semaglutide, Ozempic, and this is how it has transformed 100% time in range with 0% time below range, and the time above range is again 0. And look at the transition with profound reduction in the body weight and with significant improvement in the overall quality of life. So these are the 5 different pens, but they are available in different sizes. The 0.25, 0.5, they are smaller pens, and these are the bigger pens. And let me take this opportunity. All of you are already aware, there is a registration desk available downstairs, and let me invite all of you to the 53rd edition of RSSD annual convention. And this is in the month of November in Kochi. So Wegovy, Ozempic, and the similar therapies are blockbusters, and all the doctors need to be familiar with these therapies, because patients are probably going to ask you, because they are familiar with these therapies since it is appearing in the social media and in the frontline media all the time. And this is a summary, more than or equal to 20% weight loss in 1 out of 3 patients, and the weight loss is sustainable. Though the data is for 4 years, actually the real world data with Ozempic and the similar injectable semaglutide molecule is available for more than 6-7 years. And the significant health gains that we will be discussing in detail, the subsequent 2 prominent key opinion leaders from India, Dr. Shashank Joshi and Dr. Hemant Thakkar. And thank you very much, Novo Nordisk and my dear friends, for your patient hearing.